Now, 81-year-old Dr Anthony Fauci about to step down as the top medic, Nick. How will he be remembered? He was a divisive character through not necessarily the 80s and the 90s, but certainly through COVID.
He was an extraordinarily powerful figure in public health, not just in the United States, but around the world. He had that kind of influence. He was the father of the lockdown, essentially, I think, in the West. And I think for that, he deserves to go down with a very poor reputation. I mean, he was the one who argued for this. He was the one who argued against more selective support for the aged, for instance, or the vulnerable. He was the one who went out and rubbished and criticised people who came up with alternative forms of treatment. He was the one who stuck with the idea of the vaccines and the idea that they should be almost mandatory. So I think he's got a lot to answer for. Many of the things we now recognise as overkill and mistake started in his office and were driven by him and spread around the world. I think when the full story is written, he will come out of this very, very badly. And we haven't even mentioned his close connections with the pharmaceutical industry and, of course, the research lab in Wuhan. He's not doesn't come out of this well.
The latter is something we can never forget. Adios, amigo, I say. Now, Jennifer, you've written about the cashless welfare card this week. We've discussed it at length on this program. I've spoken to Indigenous women, politicians, experts, community leaders. As you write, the card has been a success. What are we going to do when crime rates in these communities go through the roof again?
Well, we're going to hold Labor, the Greens and the selected independents who support the repeal of the legislation for the cashless debit card accountable. That's what we're going to do. One of the things that Labor's betting on is that we forget that they were responsible for taking away a system that prevents financial predation, that prevents people preying on mothers and fathers and depriving families of basic necessities like food, shelter and safety. We are going to hold Labor accountable for getting rid of an approach to welfare that potentially empowers Indigenous people to take hold of their own money and to protect it from that kind of predatory behaviour. And I think the other thing we need to remember is that alcohol-fuelled violence, drug addiction are the main causes of disadvantage in a lot of Aboriginal communities and non-Aboriginal, just very poor communities around the country. And if you don't have anything to control cash spend on those sorts of addictions, you end up with spiralling violence, intergenerational poverty and a lack of accountability from government for any of it. And it's completely unacceptable also to the Australian taxpayer that's throwing tens of billions a year into programs that aren't properly monitored and the government takes no responsibility for it. So we need to see Labor step up at this moment, not step back from their responsibility to help change outcomes for disadvantaged Australians.
We're heading in a very, very awful place with this, I tell you. And the same goes with the lifting of those alcohol restrictions in the Northern Territory where I've just been to. Nick Cater, Jennifer Oriel, I've run out of time, but thank you very much for yours tonight.